Alright, team, here are the symptoms we're dealing with. Acute hemorrhagic conjunctivitis metallicis and pharyngitis. What do we think we're looking at here?
Well, acute hemorrhagic conjunctivitis could indicate a viral infection. Metallicis suggests metal poisoning, and pharyngitis points to inflammation of the throat.
I'm leaning towards a rare genetic condition, possibly affecting the immune system. These symptoms are quite unusual to have together.
I agree with Kelly. This feels more like a genetic disorder than a simple infection or poisoning.
You're both right. It's Genetic Alliance UK. We need to act fast. I want all of you to perform plasma coagulation on the patient immediately.
Plasma coagulation? But that's extremely risky, Hawks. Are you sure that's the right approach?
Damn it, Gary. I didn't spend years studying medicine to have my decisions questioned. I know the risks, but I also know it's our best shot at saving this patient's life. Now get to it, all of you. Tracy, you called me into your office?
Yes, Hawks. Ablation on your patient with genetic alliance. Are you sure about this?
Of course I'm sure. I have years of experience in dealing with cases like this.
But Hawks, we need to consider all options and make sure it's the best course of action for the patient.
I don't need you questioning my expertise, Tracy. I know what's best for my patients.
I understand your confidence, Hawks, but let's discuss this further before making a final decision.
Fine, but just know that I have the patient's best interest at heart, always.
Oh no, this is not good. The patient is in critical condition after the plasma coagulation. How am I going to explain this to Hawks? This was definitely not the right treatment for Genetic Alliance UK.
What were you thinking? You three nearly killed our patient with your incompetence and negligence.
But Dr. Hawks, we did our best with the information we had.
I still think it was a case of rare plasma coagulationemia, not plasma coagulationitis like you said.
No, it was clearly a case of plasma coagulonitis. I stand by my diagnosis.
You're all a bunch of quacks. I can't believe I trusted you with this patient's life. Get out of my hospital.
But Dr. Hawks, we...
Enough. I've had it with your excuses and incompetence. I'll be taking over this case from now on. Don't you dare interfere again. I can't believe I couldn't figure out what was wrong with the patient in room 302.
Maybe you should check for pulmonary embolism. That could be it.
I already ruled that out. It's not as simple as you think.
Well, did you consider a rare genetic disorder? I've seen cases like that before.
I did, but the symptoms just don't match up. Wait a minute. I think I know what it is now.
Really? What is it?
I'll have to run some tests to confirm, but I believe it's a severe case of poisoning. I need to go take care of this. See you later, Johnson.
Wait, you can't just leave like that. Hawks. Well, alright then. Good luck, I guess.
Genetic Alliance UK was wrong about this patient. It's not schizophrenia. It's musical hallucinations.
Musical hallucinations? Are you serious? We can't diagnose without proper tests and equipment?
Hawks, this is unacceptable. We have protocols for a reason. You can't just barge in here and make bold claims.
I agree with Kelly. We need to follow procedures and ensure our diagnoses are accurate.
Trust me on this, guys. I've seen enough cases to know when something doesn't add up. We need to act fast before it's too late. Tracy, I finally found the right diagnosis for the patient.
Congratulations, Hawks. It's good that we got it right in the end.
If you had just listened to me from the start, we wouldn't have had to go through all of this.
Hawks. Oral diagnosis could have been fatal for the patient. You should have trusted my judgment.
Trust your judgment. Look where that got us.
It's not about trust. It's about working together as a team.
Team? You mean me following your every order without question?
I mean, us collaborating and discussing cases, not just acting on impulse.